Good day, this is Kimberly M. Pangilinan from BSN1B, and in this video, I will demonstrate how to obtain the vital signs, which are a group of the 4 to 6 most crucial medical signs that indicate the status of the body's vital functions. The first thing to do is to assess any clinical signs and symptoms affecting the vital signs. Determine the site that is most appropriate for measurements of vital sign and the factors that may alter the vital sign. Skin and mucous membrane color of the client and the appropriate position for the procedure. Also, assess the activity tolerance of the client. Check for chest pain, for dyspnea or shortness of breathing, signs and symptoms of hypertension or hypotension, and the factors affecting the blood pressure. So, in preparation, determine the policies and procedures for the facility and the client's record for medications that may increase or decrease the vital sign. I have here assembled the equipment and supplies that I will be using throughout the procedure. So, we have here the thermometer, tissue, or you can also use wipes. And also, you must wear a watch with a second hand or indicator, which is I am wearing right now. I also have here my stethoscope and a sphygmomanometer, or commonly known as the BP apparatus. So I have here my patient. What's your name, ma'am?
Rochelle.
Good morning, Ma'am Rochelle. I am Kimberly M. Pangilinan from NEUST, and I will be your student nurse for today. I will be the one who will take your vital signs, and these measurements are taken to assess your general physical health, to give clues to possible diseases, and to show progress towards recovery. So, I've already washed my hands, so we will now start the procedure. First is I will take her temperature. So grab your thermometer. Clean the thermometer from the tip to the body. Then place it to the appropriate root. Then wait for the thermometer to produce a sound which indicates that the reading is complete. So we are now done, and the temperature of our client is 36.5, which is normal. We will now proceed on the pulse rate. So the first thing to do is to select a pulse point. Palpate and count the pulse. Place 2 or 3 middle fingertips lightly and squarely over the pulse point. Okay? So, the pulse rate of our client is 68 beats per minute, which is normal, and it also has a normal rhythm and volume. Next is for the respiration. First is observe and palpate and count the respiratory rate. Ma'am Rochelle, may you please put your hand on your chest? Now, count the respiratory rate for 60 seconds. Remember that one inhalation and one exhalation is equivalent to one respiration. Okay, so the respiratory rate of the client is 18 breaths per minute, which is normal and it has a normal rhythm and depth. Now, lastly, we will now take her blood pressure. The first thing to do is to rub the deflated cup evenly on her arm and locate for the brachial artery and apply the center of the bladder directly over the artery. Then, place your stethoscope appropriately. And then auscultate the client's blood pressure. So, the client's blood pressure is 120/80, which is normal. After the procedures, document the data obtained, which are the TPRBP in the vital signs record sheet, and if there are any abnormal results, report it to the primary care provider. And most importantly, document all the procedure done in the client's record. And that is how to obtain the vital signs, and this ends my return demonstration video, and I will see you on my next one. Thank you!